look better with the light? Is it bright enough?
Odyssey, at eminentradio.com. eminentradio.com. That's not even right. That's just here, get back to me. That's the one. Do that.
You know, we're using will.
I feel overdressed.
You look very
I'll be
nice.
there.
Come on, Chris.
Yeah.
Come on.
Yeah, come on out here. Come join us.
Just this way a little bit.
This way?
Yep. Thank you.
Is that good?
Thank you. Good morning. My name is Sydney Pedersen and I am a PACU nurse at Fairview Riverside. It's hard to believe that we're here facing this situation again. A reality once again, hospitals are refusing to work with nurses at the bargaining table, especially when it comes to patient safety, protecting nursing staff, and ensuring a healthy, sustainable workplace for everybody. We've been at the bargaining table for 3 months. Nurses have brought forward serious proposals about affordable, accessible healthcare plans, safe staffing and protections against unsafe scheduling, the rising violence we face at work, and respect for the professional sacrifices we make every day. Leadership has refused to meaningfully engage in these issues. They've proposed taking away our long-standing, affordable healthcare plans and replacing them with high-cost options. The hospitals want to cap sick time at 48 hours per year with an overall bank of 80 hours. We're healthcare workers on the front lines, exposed to illness every day. We gown up, we glove up, we mask up, and still take our work home. Under their proposals, we'd be allowed only 4 hours of sick time per month to recover and take care of our families. The hospitals also want the power to unilaterally cancel our shifts and send us home. Nurses already voluntarily take low need days with a cost savings to the hospital of over $13 million over the past 2.5 years. They propose cutting overtime pay when we stay past our scheduled shifts to help cover gaps. Instead of staffing safely, they want to rely on overworked nurses volunteering extra time for no additional compensation. Inside the hospital, conditions are deteriorating. Frustrated patients and families struggling to access care are directing their anger at us. Violence toward healthcare workers is rising at alarming rates, and we're left to absorb the impact. We've asked for duress buttons to call for help in emergencies. Leadership responded by demanding allowing the technology of those systems to monitor and track our every move, not to improve patient care, but to discipline us. After years of dedicated service, we're treated as data points. And now they've offered us a wage increase so small it doesn't even make up the cost of living. Another line item in their plan to cut costs and maximize revenue at the expense of patient care and worker well-being. These issues are serious, but what led to the strike authorization vote is not just the proposals themselves. It's the hospital leadership has engaged in unfair labor practices, including refusing to bargain in good faith, withholding information, and attempting to undermine our union rights. That is why nurses have voted to authorize our negotiating team to call a ULP strike. We don't take this step lightly. Nurses care deeply about our patients and our work. But when leadership violates the law, refuses to engage, and puts both patients and workers at risk, we have a duty to act. The vote is a message. We are serious, we are united, and we will take action if needed. Not just for ourselves, but for the patients who depend on safe and reliable care. Thank you.
Alright. Hello, my name is Greta Stoffaker, and I'm a nurse at Children's Hospital in Minneapolis. I've proudly served as a nurse for almost 2 years now. We've been in negotiations with Children's leadership since March. Today marks our 12th bargaining session. Nurses on our bargaining team do this work on their own time, unpaid, though our contract guarantees they receive credit toward benefits and seniority. This doesn't cost the hospital anything, yet Children's management is refusing to credit this time. forcing nurses to either use vacation hours or pick up extra shifts. It feels like a deliberate effort to discourage participation in bargaining and punish nurses for standing up for our coworkers. We've brought thoughtful, solution-oriented proposals to the table, focused on safe staffing, nurse retention, and protecting patient care. Most have been ignored. Instead, Children's has proposed gutting our contract and cutting benefits. Children's used to be a place where nurses were proud to work, not just because of the impact we have on children's lives, but because we were respected. That's changing. As executives focus more on financial goals, nurses are expected to do more with less. But when we're short-staffed, it's our patients who pay the price. We've been told Children's is not interested in our safe staffing proposal. Instead, they've asked us to be more flexible. But we're not elastic. We're nurses. We stretch ourselves every day for our patients. But we have limits. If we keep bending under these conditions, we will break. In addition to the slow progress at the table, we've seen actions from management that we believe undermine the bargaining process. When nurses are told they must use personal time to prepare for negotiations, despite the protections in our contract, it sends a message that our voices are not welcome. These actions have led nurses to file unfair labor practice charges. It's not just about slow bargaining anymore. It's about how management is treating nurses who are trying to advocate for their patients and their coworkers. It's part of a pattern that shows a lack of respect for nurses' role in shaping our future of this hospital. That's why nurses at Children's Minneapolis-St. Paul and Mercy campuses have voted to authorize an unfair labor practice strike. This was not a decision we made lightly. Nurses want to be at the bedside caring for patients. But when our ability to advocate is being threatened, we have to act. This vote sends a strong message. We are united, we are serious, and we are prepared to take action to defend our patients, our profession, and our contract. We're not asking for extras. We're asking to be heard. We are calling for the safe staffing, support, and respect it takes to deliver safe, ethical care. We need a meaningful voice in decisions that affect our work and our patients. We are the kid experts, and we're ready to do whatever it takes to win safe staffing and a fair contract.
Good morning. My name is Jess Busselman. I'm a nurse on the medical surgical oncology floor at Abbott, and I'm also a member of the Abbott negotiating team. We've now sat across the table from Alina 9 times during these contract negotiations. 9 times. And still, they refuse to meaningfully engage on several of our proposals, especially our staffing proposal, which directly impacts patient care and nurse well-being. We've poured our hearts out on those sessions, sharing the brutal reality of what it's like on the floor, the cuts, the chaos, and the care that's slipping through the cracks. We've given tearful testimony, we've been brutally honest, and still, Alina's leaders sit across from us, disinterested, dismissive, and unwilling to even have a conversation. Let me be real with you. This isn't just about feeling unheard. This is about the dangerous consequences of cost-cutting decisions made by our executives who've never stepped foot on our unit. We're being asked to do more with less, fewer resources, fewer nursing assistants, and less support for patients. We're burnt out, we're drowning in impossible workloads, and morally wrecked from having to deliver the bare minimum instead of the care that we've been trained to give. There are days when I'm in a patient's room trying to offer comfort to one of the worst moments of their life, a new cancer diagnosis, and I get pulled away by alarms, meds, or other emergencies down the hall. There's no backup, there's no relief, and there's no breaks. Just me trying to hold it all together. This is not sustainable. Nurses are leaving because this job has been made unbearable. And while we're out holding things together with sheer willpower and caffeine, Alina is breaking the law. We've filed unfair labor practice charges because they've refused to bargain in good faith. That's not just a bad look, it's a legal violation. This isn't just about stalling at the table, it's about an employer actively disrespecting our rights. That's why we took the step to voting to authorize a ULP strike. No one wants to walk off the job, but when leadership refuses to follow the law, refuses to even talk about safe staffing, and pushes nurses to their breaking point, we're left with no other choice. This vote is a message. We're not bluffing. We're united and we are serious. We are ready to strike if that's what it takes to protect our patients, our profession, and ourselves. Alina needs to remember, it's the workers who've kept these hospitals running. It's the nurses who show up day and night for people in those beds. We shouldn't have to march on the streets just to be treated with respect. But if that's what it takes, we'll be out there. We're calling on Alina to stop stalling, stop violating the law, and start bargaining seriously. Nurses deserve better. Patients deserve better. And we're not backing down.
Good morning. My name is Pam Whaley. I'm a peri-anesthesia nurse at Methodist Hospital. As you all know, yesterday we nurses gave our negotiating team the ability to call an unfair labor practice strike if needed because our employers are breaking the law by refusing to bargain with us in good faith. Our employers have had our contract proposal since mid-March, and not one facility has made a counter to our staffing proposal. In fact, they have all said they are simply not interested in discussing the safe nurse-to-patient ratios. This is incredibly disheartening to hear from those in leadership positions at our facilities. Ask yourself, why would leadership at a medical facility refuse to even consider safe ratios? Why do administrators fight against the nurses to prevent us from something that only helps our patients? They say it is because the economic toll of hiring staff would have a negative impact on the facilities. They say this while receiving tens of thousands of bonuses every single year. We nurses are fighting for this and other proposals in the hopes of bettering our contracts to bring new nurses to the bedside, keep our current nurses at the bedside, and ultimately so we can continue providing safe, compassionate patient care. I'm certain you will be hearing from them today about how we have unreasonable asks, but we are telling you what is actually happening inside our hospitals. Currently at Methodist, we have patients that are being treated in the hallways and the lobby of the emergency room. There are patients waiting in surgical recovery up to 10 hours, and cardiac patients receiving care in the hallways of our interventional radiology department. All of these patients are there because they are waiting for inpatient rooms. All of these patients are getting their treatment delayed due to these waits, and this can prolong the amount of time they need to be in the hospital. Not only do these waits prolong the patient's time in the hospital, but every additional patient added to a nurse's load increases the possibility of death and prolonged hospital stays by 16%. In my 13 years in healthcare, I have seen nurses be required to do more with less. This trend is not improving. Too many times I had patients apologize for needing my help to go to the bathroom or needing pain medications, stating, "You're so busy, I don't want to be a bother." No patient should know that we are short-staffed. No patient should ever feel like a bother or feel like they need to apologize to me while I am providing the care that they need. I transitioned from working as an aide to a nurse because the work is fulfilling. I'm able to provide care for those in need. Even on the hard days, I still love what I do. There were dark days of 7-to-1 patient ratios. I felt so disheartened because I was providing a bare minimum of care, and I knew it, and I knew that my patients deserved better. This type of work leads to burnout, and it leads to nurses leaving the bedside. I am speaking today because I care about my patients and my colleagues. I want to be part of creating an environment that makes people excited to pursue bedside nursing as a career.
Hello, my name is Joe Steiger, and I am a nurse at North Memorial Robbinsdale. After months of conversations with nurses, we've identified serious issues that affect our ability to provide quality patient care and are driving many nurses away from the bedside or out of the profession entirely. These are issues North Memorial leadership has refused to bargain on. Issues like workplace violence. This is still happening far too often. Nurses shouldn't have to fear getting hurt so badly they can't work or worry about whether they'll make it home safely to their families. Health insurance. Nurses need to stay healthy for our families and our patients. Healthy nurses provide better care. It's just that simple. Staffing, it's not just about ratios. It's about getting breaks to eat, to use the bathroom, and being heard when we say an assignment is unsafe or unmanageable. North Memorial has told us they are not interested in bargaining over staffing, and that says a lot about where their priorities are. Fair pay and benefits. Nurses are at the bedside 24/7 from birth to death. CEOs and board members aren't. While hospital executives take home millions of dollars, some nurses are struggling to make ends meet. My personal breaking point came when I caught myself making excuses to leave patient rooms quickly because I had 5 other patients waiting for care. I wasn't avoiding the work, I simply didn't have the time to stay, and that time matters. Providing care isn't just about giving medications or checking vitals. It's listening, educating, reassuring. It's being present for your patients. That's the care that helps patients heal. When nurses are stretched too thin, that care disappears. Patients feel it, families feel it, and nurses feel it most of all. We're not asking for better staffing for ourselves. We're demanding it because every patient deserves the full care that nurses are trained to provide. And the hospital leadership has a responsibility to make that possible. By giving us the time, the staffing, and the resources to do our job safely and well. North Memorial says they're doing good enough on workplace violence, but that's not good enough when nurses are scared to come to work or are out for months recovering from injuries, like some of my coworkers. We've brought serious concerns to the table about staffing, safety, and workplace conditions that are directly affecting our ability to provide care for our patients. Leadership has refused to engage on these issues, and that's why we're voted to authorize a ULP strike, because North Memorial has refused to bargain in good faith over critical issues that impact patient care and nurse safety.
Questions?
What was the vote?
Every facility voted yes.
It was 100%?
Yes, all 13 facilities voted yes.
Did we go in a percentage? We don't release that by policy.
Okay.
Do you have the exact number of how many nurses voted? I know it's around 15,000. Is that how many voted, or just how many that the strike?
And we don't release the voting results by policy.
Can anyone from the Nurse Association just kind of clarify? I know when the last contract was ratified in December of 2022, the Nurse Association said that it included like some wage increases, but also a historic win and some unprecedented language to address staffing shortages. And that was less than 3 years ago. So I'm curious, did that not work? Is that something that the hospitals are trying to repeal, or what happens? Because the average person would see a few years ago it looks like they had a solution for that, and now it sounds like it's still the sticking point for the frustrations now.
I can talk about it.
Could you step up?
I can. So my name is Erica Helling. I work at Fairview Southdale. We did earn language, and it specifically says that the grids, or the way a hospital is staffed, could never be moved downward or lessened unless we had consensus. So everybody had to agree. We didn't agree, and they did it anyway. And we are in this arbitrary process, which takes months. I think we've been at it for 18 months now, trying to resolve this language that we earned that the employers are ignoring. So they agreed to it to get the deal done, and here we are.
For those of us who aren't nurses,
Yep.
or don't work in a healthcare setting, can you just, in layman's terms, kind of explain like what the grid is, kind of the issue at hand here?
So the
to speak?
grid, which no one wants to admit, is a ratio. So we have ratios already. We call them grids. So there are a certain number of nurses per a certain number of patients. We all agree to those grids annually. We have grid reviews. And when we went through our review system at Southdale, we said, we don't agree to this. You're taking away skill, taking away nursing assistants, taking away an RN at certain census points. So downward grid, no consensus. Our language said, we don't agree, this can't happen. And they said, we disagree, we're doing it anyway. And then we have the grievance process, which takes a very long time. And then we get in front of arbitrators, and then that decision is made. We are still in that process 2 years later.
So what you're saying is the policy is something you agree with, it's just the way it's being enforced is.
The contract
Yeah.
that we have with them says they will not do what they did. And so we have to fight.
And so the safe staffing proposals that are on the table now that y'all are trying to get in new contracts, would that go beyond that policy that was approved in 2022?
We describe it as having more teeth. We thought we had what we needed, and they found a loophole that they presume is a loophole, and so now we have to argue that in front of those who ultimately can make the decision. So the newer policies have more ways that we can hold them accountable. I'll step back.
A technical question, can someone, for an unfair labor practice strike, you have to file claims with the National Labor Relations Board. Has that happened across all the systems? Is that going to happen? Just a quick question on that.
So, you add, oh, sure. Where do I go up there? I don't know if we do this, so, sorry. All right. We can't shoot back. I apologize, I have a bit of a cold. John Aho, I'm the field director with M&A. So they are unfair labor, this is an unfair labor practice strike. We're in the process of filing charges. The charges, it needs to have taken place within the last 6 months. I think some of them are filed. I think some of them are in the process of being filed throughout the different systems.
And then my other question is, this doesn't mean a strike is imminent. This means you have the authority to call for one with a 10-day notice. Is that correct?
Correct.
Any thoughts on timing, like how long you're going to let this go before you go on that?
A decision the members are going to have to make.
Okay.
John, can you say and spell your name first and last one more time?
Sure. John, John. Last name is Aho, AHO.
And then you're the field director.
Yeah, field director.
Field director, sorry.
Sorry to pull you to the podium.
No, it's fine. I'll step back and let nurses answer questions unless you have anything else for me.
Are any of you guys tired of this continuous negotiation thing?
You think?
I can't count how many times I've covered this same press conference.
Sure, yeah.
What do y'all think about this?
Are you tired? Have you been in the hospital lately?
I was in the hospital in February.
Yeah.
Want to see the scar?
Yeah. I believe you, and I wonder if you felt the impact of having.
Well, I'll step to the microphone though. You can't hear
Sure.
me.
Yeah, I wonder if you felt the impact of having short nursing as a patient. That's what this is about. That's why we're here year over year. We want to talk about it. This is for you. I mean, this is my job and my career, and I care deeply about it, but I care about you, the public. You know, we keep singing this song, and when is it going to be heard? When will finally something happen? The legislature says no. Employers say no. You know, we need the public to get involved here, too. You deserve care. All of it, not half of it, not 10 minutes of my time. If you need a half hour, you deserve the half hour.
I know this is kind of a repetitive question, but again, I think for our viewers who the last they remember seeing this was a historic agreement, looked like everyone was on good terms. How did we go from that to this, you know, in the course of the last few years? Can anyone just speak to that at all?
Yeah,
You know
did
what
it.
the I
Yeah.
but
So-
I have an opinion.
Yeah, we all have opinions. So yes, we thought we were on good terms. We thought we had enough teeth in the game with our last contract. And again, they found loopholes to benchmark us. That's what they're calling it, benchmarking, okay? So almost two Novembers ago is when they decided to do this. they said, hey, we will have 3 meetings, we'll talk to the nurses on each floor, and we'll discuss what staffing changes we can make, grid changes we can make on the floor. And we blatantly said, no, this is not gonna work. This is not gonna be okay for our patients, and our nurses are not going to be safe. They decided to do it anyway. We've had, on my floor, we had another benchmarking meeting just recently, because on our contract it says that if there is a pattern of missed breaks, we can have another meeting about our grids, okay? So we did. Our overnight nurses are not getting their breaks. They have 6 patients on nights, and that night for us starts at 7 p.m., okay? Not 11, starts at 7. And on my floor, my charge takes patients. So my charge has 3 patients. Everybody else on the floor has 6 patients, 5 or 6 patients, okay? So they don't want to give away 6 of their patients to somebody else on the floor to have to take 12 patients overnight, okay? So many things happen overnight. Anything that we have done during the day shift typically will start being affected later on in the day and into the overnight. So it's a very scary situation. We only have 2 nursing assistants overnight, which is 15 patients per nursing assistant, to answer call lights, finish up, getting cares for the day, all of those things. So when we have that, we're looking at it going, there's no way that this is even possible. Things aren't getting done. All of the pressure injuries, falls, all of these things are increasing because we have more and more patients with less and less help, okay? I don't know if that answers your question, but they are not allowing the nurses to help with the staffing situation. They are just dictating it to us, and they are not taking anything that we say, any of our pleas, anything like that, to help us create better ratios. They're saying that they don't want to staff by ratios. That's exactly what they're doing right now. So I just don't, I don't understand why they can't help us and help the patients in the meantime.
So there might have even been a period of time under this current contract where things were like they were, but then it sounds like they found a loophole, so to speak, and kind of started to walk.
Yeah, so I can't remember when we ratified. I think it was December of 2022. And then I think November of 2023 is when they implemented this benchmarking. And don't get me wrong, they are going to continue to keep doing it if we don't get these in our contract. They will continue to find loopholes, and they will continue to do it. If we ratified today, I would not doubt that in 2 months they would benchmark us again. It's saving them money. That's just where I'm at.
I'd also like Sydney Pedersen from Fairview Riverside. I'd also like to add that the acuity of patients is increasing and has been for quite some time. And the language and the practice that we have for staffing does not account for patients' acuity, which means how much care they need, how sick they are, if they need a higher level of care. And that is what another voice that we're trying to bring to the table to make decisions for our patients. That each patient isn't the same and doesn't require the same care that every other patient does. And as far as finding loopholes, I think the hospitals also understand that they can violate our contract and force us to go through the grievance process because it takes a very long time. And meanwhile, we're working in unsafe conditions and patients aren't receiving the care that they deserve because of the conditions the hospitals have created.
So I appreciate everything everyone is saying, and to sort of address Jess's remarks. I used to travel, and at my last contract, we were 7 to 1 at night with no aid, everything she said. It wasn't safe. They were pulling sitters for patients who needed one-to-one, and I didn't leave bedside nursing. I went to peri anesthesia, where we have very strict limits. And peri anesthesia departments across healthcare, and I've been in enough facilities over my years, they get the staff and the aides that they need. I don't have to worry about that. I am not here for me and my department as much as I am here for these nurses who are on the floor, who can't take my patient who's ready to go to the floor, who would like to see their family because they had surgery and they've been ready to go for 6 hours. But there is no nurse to take my patient. That's why I'm here today. And I have been, again, in enough facilities. Administrators as a group tend to look at the bottom line. Not all of them, but too many. And they will push us and push us and push us because they know as nurses, we want to take care of our patients. And we will not go to the bathroom, and we will not take breaks, and we will stay 2 hours after our shifts charting so that our patient gets the care that we can give. And that's why we are all here today.
Can I ask a question for Greta? I just, as the young nurse and.
Yeah.
Hey, I'm an old reporter, I can speak. But I mean, I hear a lot of talk about how the current pressures are gonna burn out new nurses if they come in, that they might only last a year, that this isn't for being in the clinic or something else. I wonder if you could speak to that in your personal experience, if you had to endure some of the startup issues and how you still hung in for 2 years?
So our big issue is charge nurses. So there's been a time where I was 10 months off orientation and I was the highest seniority nurse on a unit and there was no charge. So those situations just feel super unsafe, and we don't have a resource to go to. Their solution is to force people to be charged, and I've talked to other newer nurses and they want to leave bedside if that's the case, because that's putting our license on the line if we're a charge and we're expected to take care of the whole unit, be the resource for all nurses. That's just not a good solution for us. So.
Can someone speak to what specific loopholes the hospitals are citing for getting around the staffing levels that were in 2022? Is it that, I mean, are they walking back staffing of like CNAs and support staff and not affecting nurses, or I'm just curious what specifically the loophole is that they're citing.
I wouldn't say that there's one loophole in particular that they're citing. I think it's just a blatant disregard for the contractual language that we won in 2022 and a failure to allow us to have a voice in any downward changes of care, which includes less ancillary staff, which would be nursing assistants, unit coordinators, somebody to run the desk, answer the phones, help families find their way, and then just overall acuity of patients. So, 8 patients that are ready to discharge are not the same as a handful of patients that are in a med-surg unit or needing a higher level of care.
And then you also, like Nell said, forcing the grievance process.
Correct, and then understanding that then the recourse we have is to go through the grievance process, which takes a very long time. So they essentially can have us function in unsafe conditions until we complete that process.
And maybe this is a technical question, but is that grievance process kind of happening parallel to the contract negotiations? Or like if y'all reach a contract, would that kind of eliminate the need to finish out the grievance process?
I would say, and I don't mean to speak for everybody, I think a lot of grievances could be resolved by some of the language we have on the table and allowing us to help with the decision-making process.
Thanks. Do you or anybody have something to say about patients who are worried about patient care if a strike does happen and nurses walk off the job? Obviously, it doesn't sound like patient care is great as it is, no fault to you guys, but then all of these nurses will no longer be there. Is this a necessary evil, or is there a message you have to patients who may be getting care at the time if you guys do strike?
I don't dare speak for patients that would be in receiving care during that time. However, I know that the public generally supports us and are behind us when we go into battles, so to speak, for better patient care, because that's what everybody deserves. And the conditions that patients are coming into the hospital, into the emergency rooms, waiting hours or days in the hallway, receiving care with limited access to bathrooms and privacy. I think that's just a minimum standard that we need to lift up, and the public, I think, would be behind us in that. I'll let somebody else speak to it.
Hi, Joe from North Memorial. I do feel that patients should be worried. Nurses that are in these hospitals currently are dedicated to our hospital and the communities that we serve. The nurses that they are going to bring in are not necessarily, attached to the community that we're serving. We care for our patients, and not saying that these travel nurses that are going to replace us potentially won't, but they can come in, do what they need to do, and move on without any thought of consequences for the reputation of the nurses in this area, the hospitals. I want to be proud to say that I work at my hospital, and sometimes that's not always the case, and that is, I should always be proud to say that I am a nurse here. Come get your care here. Yes, be worried. Support the nurses that are here taking care of you. Don't let them bring in nurses from somewhere else that aren't going to be as dedicated to you.
My last question, for anyone who's been in these sessions for order bargaining, can you at least give us an idea? Are we close? Is it farther apart than it's ever been? Does it feel like there's any sort of, I just trying to give some perspective, especially since we've been, covering this so much for the last few years. Where are we at right now?
Sydney Pedersen, Fairview Riverside. This will be my 5th contract that I will have negotiated as an M&A nurse, and this is the most disrespectfully I've ever been treated or received at the table from leadership.
Stay there, that's all you're asking that. My question is, so you probably answered this, so in previous contracts, is there a different tone this time around from your hospitals? Has it shifted that much or little? And for lack of a better way of putting it, is it political climate related, possibly?
There's definitely a shift. It is a different tone at the table. I think there's a wide array of reasons for it. And I think that ultimately it's about making sure that nurses don't have a say in how they take care of patients, and being able to be quote unquote flexible and not respecting the contract language to frustrate nurses and make us go through long grievance processes. So I'll let somebody else speak to that as well.
I'm not personally on the negotiating team, but I've heard that management doesn't come, so they bargain in the morning around 9, 10 a.m. They'll leave, and the time between them leaving and coming back gets longer and longer. Sometimes they don't show up again until 4 p.m. And just like that disrespect of just like making us sit there and wait for them to come talk to us again.
Joe Steiger, North Memorial. It's very clear that the people who are at the negotiating table haven't read our proposals honestly and looked at trying to see where we're coming from until we bring the issue up to them. We have 2 departments at North Memorial, home hospice, where they go into our patient's home and take care of our dying patients. The people on the North Memorial side of the negotiating table didn't reach out to their manager to talk to them about, what do these proposals potentially mean for your department. Some of the stuff that we're proposing is already stuff that they're doing. We just want it in the contract so that it's protected. Same with our air care that serves the 5-state area. Again, some of the language that we are asking for is actually already in our contract. It's just they're not applying it to our air care nurses because they want to consider them a separate unit or a separate area of the contract, and that's not how that's working. And again, they didn't reach out to the manager of air care, who is in the basement of the building that we are negotiating in, to ask them like, hey, what's going on? How do these affect your department? So they're not coming to the table prepared, and they're admonishing us in the emails that they're sending to the rest of the nurses that we're delaying, we're taking so much time. The audacity of one of the people on their team, they had to cut negotiations short one day because he had to go see his daughter to play, which is lovely for him. But how many times have nurses had to miss out on family obligations because we've been here taking care of our patients, and they haven't been willing to work with us to try to let us be with our families. So it's a slap in the face. I am there available to bargain 24/7. We wanted to bargain last week, the week before we did our strike authorization vote, and they said they didn't have any time for us. Like weekend, night, I will sit at that table and bargain with you as long as you want, but they have to come to the table willing and ready to work, and they're not.